Hello, my name is Mary Albert, and I am an implementation specialist with Brown& Brown. We are the broker on behalf of your group. Today, my goal will be to provide an overview of the benefits that are being offered to you so that you do feel confident in making your elections for this upcoming coverage period. Your open enrollment window is August 5th and will run through August 16th. So this is your chance to get in there and to see if you want to change your elections or sign up for a benefit. You would seek out a paper enrollment from your HR leader and make sure that you have that submitted back before August 16th. This is a passive enrollment, which means if you are happy with your current benefits, they will be rolling over to the upcoming coverage period, to which begins October 1st and will run through September 30th, 2025. Now over here, we've highlighted what's changing. Great news, your medical plans will remain the same for this upcoming coverage period. The city will cover the employee premium for one of your plans, to which I will go over that with you, and they are contributing more for that plan. The dental plan and the rates will remain the same. This page here includes great terminology you will hear me referencing so that you can go back and refer to it in the flipbook here. Hopefully this grabbed your attention down here. There are many ways to lower your out-of-pocket expenses. Today's goal is to share at least one way, if not more, as to how to do that. Now, I mentioned that date, August 16th, as to when you need to have your elections submitted if you're making any changes. I'm going to zoom down here. Once August 16th rolls around, you are sealed or locked in with the benefits you've elected for the remaining of or for the upcoming coverage period. However, if you do experience a qualifying life event, and we have listed some examples of those down here, marriage, divorce, if you a birth or adoption of a child, along with some others, please reach out to your HR leader within 30 days of the event to see if coverage can be changed. With that said, I'm going to scroll up here. You will have the option to enroll employee only or add dependents. We've listed those that are considered to be eligible dependents here. If that's the case, you would be asked to provide appropriate documentation verifying they are your dependent. This page is great and very important because you have 3 medical plans being offered to you, two to which are through Florida healthcare plans. Doesn't matter which plan you choose, I highly recommend you creating a member portal with that carrier. Florida Healthcare, if you hover right here, we've included a website to which, if you click on it, will take you to where you can register for that member portal. You can register once your plan goes into effect. The benefit of having a member portal is all your information is housed there. If you need a replacement ID card, how to seek out those in-network providers. There's a multitude of resources that Florida Healthcare puts in place for their members, some to which are there's a wellness assessment. And when you take this wellness assessment, the Florida healthcare physicians have access to this information, along with when you go in for a doctor's appointment, all of their notes and all of that, your blood pressure and all of those important things are always uploaded into the portal where you can access that information. More resources down here. One of the big things is Florida Healthcare does have a list of facilities in your area, in this area, that you can take advantage of having either free membership or discounted membership. So this is a wonderful benefit to being on a Florida healthcare plan. Other goodies as well, this Doctor on Demand is a virtual service, and we actually have a page coming up here in a few minutes that I will go over that information with you. This nurse advice line, we've included an 800 number here, 24 hours a day, 7 days a week. If you're looking for a second opinion or seeking out a question, this is a great service that you can utilize. So there's 3 medical plans being offered to you. You can see 2 of these over here. The middle and the third are through Florida Health Care plans. This one over here is through Florida Blue. I'll start with the Florida Health Care plans and then I'll jump over to the Florida Blue so that you can make those comparisons. The greatest question listening to this recording for this upcoming coverage period is to think of what your current benefits look like, what's working, perhaps what's not working, or if you have any procedures or treatments scheduled for the upcoming coverage period. When you think of that, it will help guide you into making the best plan choice for you or you and your family. So what's the same on all 3 plans right here? This preventative care. When you stay in the network, this plan, the network's name is Blue Options. Be mindful, Florida Blue is the carrier. Blue Options is the network. Whereas the middle and the third plan, it's Florida Healthcare. When you stay in network, and you go to your annual physical, that includes your annual blood work, any preventative screening that is appropriate for your age and gender will be covered at 100%. I do advise when you make that appointment to use that terminology so that it is coded correctly. There are roughly 2 ways you will pay for a service. You will either see a service that says the word deductible and perhaps coinsurance, or you will see copay. Now, there's many more services that your plans cover. We like to take a snippet on this page so that you understand how your plans work. I'm going to start where you see the word deductible. And like I said, there could be more services that have that terminology beside it. So for example, if you elect this middle plan and you have a service that has the word deductible beside it, when staying in network, you are offered a reduced, negotiated, contracted rate for that service. So any of the money that you spend, all of that would go into, let's call it a bucket, and that's your deductible bucket. So if I'm using this middle plan as an example, and I've paid that negotiated reduced rate, and I don't hit that $250 for employee only amount, that is fine. If I go back for that particular service or another service that says deductible, I'm still paying that reduced rate. If I were to hit or meet my deductible, again, you can see this top number reflects one individual, whereas the bottom is if you're adding those dependents. So for the example of this middle plan, if I meet $250 through a service that says deductible, imagine a wall knocking down. You then go on to phase 2. Phase 2 is called coinsurance. Coinsurance is a cost sharing between you and the insurance company. So on this middle plan, if I then were to go back, let's say outpatient hospital facility service, I now am only responsible for paying 10% of that bill, whereas Florida Healthcare would pay 90%. Your third phase, I say your worst case scenario, is this out-of-pocket maximum. If on this plan you were to be out of pocket $3,000 in health covered related services in network, health covered services thereafter when staying in network would be covered at 100%. One thing to note, your policy runs into next year. However, your deductible and your out of pocket do track on a calendar year. If you don't see deductible plus coinsurance, you would see something that just says a copay. A copayment is a fixed flat dollar amount that you are expected to pay at the time of service. I like to say, imagine it's like a ticket that you pay to go back to see the doctor. So I'm going to go to this Florida Blue plan, this Blue Options plan as the example on this one. You'll see there's 2 different copays if you went to a primary care physician. Anytime in Florida Blue you see value choice, that would be for a certain amount of visits at a lower copay. How do you know if a physician is a value choice provider? That member portal page, Florida Blue has one as well. You would see it designated there. It just means those physicians have a better negotiated contract with Florida Blue, and your copay would be lower as such. Nonetheless, sometimes it's just a flat $20, again, staying in network. When you make a copayment, it tracks to the the bucket that matters, this out-of-pocket maximum bucket. So you can take a look at how these plans work and what you would expect to pay for certain services. Now, all three plans do have prescription drug coverage. Very important to know to get this prescription filled if you're using your insurance at an in-network pharmacy. Depending on if you go to your member portal page, if you have a monthly prescription, there's a pharmacy tab. You can type in that prescription name. It's going to place your prescription into a tier. Depending on what tier your medication falls under, would be the copay you'd be responsible for paying when picking that prescription up. Now, talk to your doctor if generic is in your best interest. Oftentimes, that lowers the cost. Getting something written in 90-day supply also is a great way to save money. Over here, if you elect one of these Florida healthcare plans, you'll see there's different amounts. Florida Healthcare does have their own pharmacy. So when you get a prescription filled through that pharmacy, it's going to be at a slightly lower cost to you. Note that after hours, or if it's more convenient to have it filled at a Walgreens, be mindful, it's not all Walgreens, it's standard select Walgreens. All of that information can be found in your member portal. Now I'm going to zoom out so you can see this at a glance. The Florida healthcare plans do not have out-of-network coverage, whereas this Florida Blue plan does. However, I would like to note the difference when you step out of network. So if you elect this first plan and any money that you're spending is tracking towards that deductible or tracking towards that out-of-pocket maximum rather, the moment you step out of the Blue Options network, those buckets start over at zero. They are not combined amounts. It's quite expensive to try to go in network and fill that bucket and go out of network. In addition, those doctors will not offer you a reduced negotiated contracted rate because they don't have that contract with Florida Blue. So oftentimes those services are at a higher cost to you and you'd be responsible for that. I always say if it's in your best medical interest to seek care outside of that network, on this first plan, you will have that as an option. However, when you can, staying in network is going to be the best way. And Blue Options is a large national network. And you can always pause this and take a look at these costs to you. This is a great plan here. I can't advise. They're all three great plans, but I want to note that your employer is absorbing the cost 100% here for this third plan. Now, there are ways to save money, and one way is through when you have a prescription or if you receive a prescription, there are other ways to get that prescription filled other than going into your in-network pharmacy. GoodRx and Single Care are some free websites that you can take advantage of. Years ago, my daughters and I were on a plan where the prescriptions cost a little bit more. I took advantage of GoodRx and it lowered my cost from $80 down to $13. They're free websites. You type in the name of the medicine if you're prescribed, and it not only will it show you the different pharmacies it is available at, it will also show you the cost associated in picking that prescription up. Do note though, if you take advantage of GoodRx in Single Care, it does not track towards your out of pocket and your deductible. However, it is a great choice that you can make. I always say it's your skin in the game, which means where you have a prescription filled could be a potential of saving money. Down here, certain pharmacies have flat discounted rates for certain medications. So do know that as well. Right down here, I always encourage folks to create a roadmap. Where will you go if you're not feeling well? Of course, you have that nurse advice line if you're on the Florida healthcare plan. Florida Blue also has a similar uh, licensed health professional line where you can speak to someone. Seeking out care from your doctor in network, those are always going to be at your lowest cost. Urgent care, I have some examples of how to lower those expenses. Make sure you're minimally seeking out care at an in-network facility. That's going to be at a higher cost. And in an emergency situation, if you do go to the hospital, that is going to be at a higher cost. And minimally, make sure you're going to an in-network hospital if you need that. Speaking of where to go, Florida Healthcare has facilities. We've listed them here where you can go for a variety of different reasons. And if you take advantage of some of these facilities, this is at a lower rate, $10 to be specific. So instead of paying, one of the plans was, I believe, $100 for urgent care. This could really save you money by only paying $10. So this is great information to go back and to look at. This virtual visit, Doctor on Demand, is a great thing to take advantage of. You know your body best when perhaps this would be appropriate care for you. You're connected with a licensed health professional. If they deem it medically necessary, they can even write you a prescription. My tip for the day is to get registered now. If you're not feeling well, is not the time to try to figure out how this works. So have it set up so that you're ready to go. We've included a link here for you and some costs associated with that as well. You are being offered dental coverage through a different carrier called Guardian. If you click on this link right here, it's going to take you to the Guardian Anytime website to where you'd want to search for an in-network dentist. It's very similar to medical. This particular plan, you have in and out of network coverage, and you might say the percentages look about the same. When you stay in network, those dentists are going to offer you that reduced rate. So the plan will pay for the percentage of the in-network rates. You have $3,000 that's set aside on this plan to pay for those eligible dental claims throughout the year. And that is for each person on your plan to pull from that bucket of money. And that replenishes the beginning of the year. In order to maximize your plan, that money is going to go a lot further when you're staying in network. Preventative procedures, we've listed those as long with the frequency. This payment of those particular services are just going to pull from this $3,000. Basic procedures, you would have to meet a one-time dental deductible per calendar year, and then the plan pays at a certain amount. Now, there's really great news about your dental. This is rare. You have a dental rollover feature. This is automatic. So there's nothing that you have to do in order to take advantage of this. This is rare, and this applies to the PPO. So when you're seeking out care at certain places, you want to make sure that, again, this is the dental plan that you're signing up for. The way the dental rollover works is you have to go to the dentist at least one time, and out of that $3,000, not use more than, your claims could not go over $1,000. If you've gone at least once and your claims are below that amount, a certain dollar amount rolls over. I love that because I've yet to be on a plan like this myself. So this is great. For those that seek care out of the network, $500 can roll over, whereas they reward you for staying in network and a higher dollar amount would roll over. This right here just reflects collectively over the years the maximum that can roll over. And there's an example down here as well that you can take time to go back and look at. Now, you are being offered basic life and accidental death and dismemberment coverage, and this is through Florida Combined Life. If something were to happen to you while you're working for your employer, City of Flagler Beach, somebody that you designate as a beneficiary would receive, I'm going to zoom in here, the amount you can read that's 1 times your salary, and then there's a maximum benefit as well. It's going to be very important that you have your beneficiaries up to date. This is something you can change throughout the course of the year, whereas you can't change your benefits without that qualifying life event. You can update your beneficiary. You can designate one person that would receive that amount. You could have 3 people, as long as their totals would calculate to be 100%. It's important to consider possibly a secondary or a contingent beneficiary if something were to happen to your primary. More information to go along with that, but this does not cost you anything. Your employer does pay for this. You're also being offered this through MetLife Legal Plans. I'm going to let you pause the recording and look through all of the different services that if you were to sign up for this benefit that you could that it could cover you on. We've included a QR code in here. I'll zoom in to make it perhaps a little bit clearer for you in order to create that account. My advice is you can see that you would be able to choose from a pre-qualified attorney or use an attorney out of the network to be reimbursed some of the cost. This is a benefit that would cover everyone here. My advice, if you're wanting to know exactly what these costs would look like, give it a call. Give the phone number a call or look on this website so that you would know exactly what to expect. And it does include some great added benefits. For example, this identity and fraud protection. And these are your key players we've listed here for you at a glance. I'll zoom down so you can see those that you can reach out to if you have any questions. I would really like to highlight my teammate, Terry Kovaleski. You're very lucky to have her. She's fabulous. She's very well versed in your benefits, and she's put in place to support you here. Some important dates is August 5th is when your open enrollment window opens, and it runs through August 16th. This is the time to get that paper enrollment form, to make any changes, and also any considerations of things that you may want to sign up for, and make sure that form is submitted back prior to August 16th. Thank you so much and have a wonderful day.